Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show. I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Celebrating Social Workers. NCSS social workers have amazing tenacity and talent. They confront the most challenging issues facing individuals and families and forge solutions that help people reach their full potential and make our community a better place to live. We celebrate the contributions of NCSS social workers during National Social Work Month during March. To discuss the important role that social workers at NCSS play in our community in greater detail, I'm pleased to introduce this month's guests. And they are Belinda Bessette, a licensed independent clinical social worker and clinical services program manager in the Children, Youth, and Family Services Division, and Deana Chase, a licensed independent clinical social worker and the Integrated Health Team social work team leader in the Behavioral Health Services Division. I'd like to welcome both of you to the program.
Thank you.
Thank you.
So, with March being National Social Work Month, it's an opportunity to explore the work that social workers tirelessly provide each day. Now first, what are the requirements necessary to become a social worker in Vermont?
You want me to start?
Okay.
So to become a social worker, you have to have a master's degree in social work. And then if you want to practice independently, providing therapy, one-on-one or family, you would have to obtain your license, which would be 2 years of clinical supervision, and then passing the ASWB exam.
Mm-hmm. And when you talk about clinical supervision, what is that all about for somebody to understand?
So you'd have to practice for 2 years under a supervisor that has a license, and then also receive clinical supervision hourly each week from that person.
Mm-hmm. Now, would you explain for the audience the difference between social worker work and counseling? Because I know there's probably a scenario there where people don't quite understand. When you talk about counseling, is that social work? When you say social work, is that counseling? Or so what is the difference between the two?
Yeah, so I think there's a lot of similarities. I think that the difference between a counselor and a social worker is the scope of practice. So counseling primarily, and social workers do some counseling as well, but the scope is usually very specific on the individual that's coming in for counseling, and also around like the concerns. So counselors really focus in on that. Yeah. From a social work perspective, it's much more broad. So we use genograms, we use eco-maps to really understand the strengths that the person and their family or the resources around them bring with them to services. We also build from a strengths perspective, so we identify the issues and concerns that a client might bring to us, but we also are really looking at what are the strengths that they have, their families have, the resources the community has around them, so that they can build on those strengths and do some recovery. I think there's a lot of similarities between the counselor role and the social worker role, especially in the independent practice perspective, because they're both using a lot of those same tools to get the work to be the best it can be for that client, that individual. I did want to just say, though, I think one of the things that I don't want to forget is that I know we're really focusing on licensed independent clinical social work today, but we also at NCSS employ social workers at a bachelor level. And so what that means is that they've had 4 years of college toward their social work, so they're learning the same practice guidelines and the same strategies and using the same ethics. And so they are actually working with families to acquire more skill acquisition, maybe in the community or in the home versus in an office doing therapy.
And I do think, I'm glad you made that distinction, because you're right, social work versus counseling, you were saying social work is broader, and it's also broader in that, as you say, at a bachelor's level, there are individuals that are providing incredibly important services each and every day.
Absolutely.
It's just that when you look at what they have achieved academically, it's a bachelor's level versus going to the master's level.
Right.
But much of the work that they do and that they provide is very similar.
Absolutely.
And I think the other thing is at NCSS, we have quite a number of social workers. When you look at our overall staff count is something over 500, but my understanding is if you look at it from one aspect or another, probably as many as 200 in some fashion are either at a bachelor's level or a master's level doing social work in one of our 3 direct service divisions. And the thing that I do want to say today is that Belinda representing children's and Deana representing behavioral health, we also have a developmental services division, which also has some individuals that are social workers as well. So, with that being said, would you explain the difference between clinical social work versus direct services social work and how that kind of aligns?
Sure. With clinical social work, you're really providing one-on-one therapy or family therapy. Also can offer you some opportunity to be in leadership roles. I mean, you don't have to be licensed to be in leadership roles, but you can be, and might afford you more opportunity to do that. And then direct services social work, it can be done at a bachelor's level, a master's level, or license level as well, where we're providing care coordination on any number of levels, connecting people with services, helping people with applying for different programs that they may be eligible for, that sort of thing.
And that's the other part, which is NCSS and our staff they're not in a vacuum by themselves. There is a lot of instances, or there are many instances, I should say, where there's a lot of community partners who wrap around an individual to try to deal with their particular circumstances. And I think it's important that people realize that NCSS staff coordinate a lot of services with other organizations locally on a daily basis to help them. It's not just NCSS standing alone, but working in concert with other organizations.
I think that's one of the great aspects of having the bachelor level social workers. We also do a lot of intern relationships with University of Vermont and USC and Smith, and I think that affords them an opportunity to use those practice skills in collaborating with community partners, working with families, working with schools, the Department for Children and Families, really to wrap around what that family's need is, and it really gives them a nice opportunity to practice that with the guidance of the clinical social worker, continuing to support them in gaining that experience and that knowledge, so that if they wanted to continue to pursue the master's, they would have already had some experiences. We also have had a lot in the children's division. We've had a lot of staff who come to us with various undergraduate degrees, and decide to pursue their master's in social work because of the tenets of social work being, strengths-based and including the entire family system. And I think that's been something that NCSS has really spent a lot of time becoming a learning organization, a teaching organization, and creating some of those opportunities. And I, from the children's perspective anyway, that's where I see the direct service being the most influenced by social work.
And I can't help but think while both of you are talking is when we talk about things like stigma, is to a lot of people on the street, they hear the name Northwestern Counseling and Support Services, or NCSS, and the first thing that comes to their mind is, I'm not going to go there because, I'm going to have to see a psychiatrist and all this. And yet, with everything that we're talking about here today so far, there is no mention, and you see what I'm getting at. I think that's important that people understand that there are all these services that we provide, and all of those services can be provided by individuals at various levels that have nothing to do with sitting in front of a psychiatrist, as an example.
Right, and we provide them outside of the four walls of NCSS. I know in the children's division, they're within schools, and my team in particular is embedded at doctors' offices, and so part of that will alleviate some of that stigma that people may feel.
I was at a meeting the other day, and it was interesting. Somebody said, well, what does NCSS do? And I started to tell them they live in the community. But when I made the statement that you just did, which is, I said a very small amount of our work actually takes place within the four walls of our buildings, the person was amazed. They said, well, that's certainly what I thought you did. And, when we started talking, just like you did, Deana, about the fact that we're in schools, you're sitting at someone's kitchen table, whatever the case may be, most of the work really is being done in the community, meeting people where they're at.
That's right.
So let's review the roles that social workers play in the Behavioral Health Services Division.
Sure, there are several social workers in our division. On my team in particular, there are several of us that are social workers, and we're embedded directly in the primary care setting. At various levels, we have one student social worker, we have master's level social workers, we have licensed independent clinical social workers on my team. There are social workers on our crisis team. There are social workers on our mobile outreach team. There are social workers on our outpatient team. And within the outpatient team, there's the elder care program, the elder outreach program, and that is a program that is provided in conjunction with CVAA in our community. And we have a therapist who goes directly into elderly folks' home and provides therapy in their home for them, people that can't get out. We have social workers in leadership positions.
And with what you're saying, Deana, it's great because, once again, so many people feel, who does NCSS serve? What's the demographic range of ages? And from Belinda in children's on through behavioral health, it's really the entire lifespan.
It is.
And I think that's another thing that gets lost as to who and what we are, that it's all the way to could be all the way to the oldest living person in our community, and depending on what their particular needs may be.
Very true.
So I think it's important that people do understand that we serve all ages, and it really depends at what point in the life cycle you may need services.
That's right.
So with that being said, let's review the role of social workers in the children's division.
Sure. So I feel like I'm going to mimic Deana a little bit, because we do have social workers throughout all of our programs. Our programs are prenatal to up to 26 in the children's division. We have people who practice social work in the schools, in families' homes, in the community, taking kids and families into the community to practice their skills. We also have a number of social workers in leadership positions in the children's division. And then my favorite is the interns. We've just really have such great relationships with the area schools around, having that be a practice spot for our interns. And so that's been one of the spots that we've really prioritized, is the social work interns. But I do think what you said earlier, Joe, is really important, that we do meet families and their resource supports where they're at. So we're in homes, we're in schools, we're in communities, we're meeting people at McDonald's. If that's more comfortable for them than us sitting at their kitchen table, then that's what we're going to do. And we're still using the same tenets of being open and available to people needing support at whatever juncture in their life. I think that as much as we talk a lot about working with families who are in need, I think we're also primarily our prenatal to 6 also really does a nice job of identifying where the strengths are and the resources are with families and expanding on that and really being preventative with a lot of the services and supports that we provide. So trying to create some peer networking. We're doing a lot of work around how do we build that resiliency and that support within the community itself instead of it being just the professionals. And I think a lot of that is social work at its best.
And what's interesting about what both of you are saying is, again, a misnomer about NCSS is that there's a stigma to anyone that we deal with is probably suffering with a mental health disorder, and that there's a stigma about walking through the door to seek services because everybody's going to know their business. And I think it's important because both of you have mentioned various places that we have staff embedded throughout the community, and that even with all of that, everything that we do is at the highest level of confidentiality, and that the only people who are privy to information about anyone that we're serving would be anybody on their treatment team and no one else.
That's right.
I think that's important for people to hear, especially in a community like ours. It's a smaller community. That it's not, if you walk through those front doors, everybody in town is going to know about. That couldn't be further from the truth. If you could speak to, because I think what's exciting is that we are so many places and we do collaborate with so many organizations, whether it's a school, now with the primary care providers and the wonderful work that's going on there, that there's a lot of people that would have gone for their physical needs to be met. But of course, the physician is not going to be able to deal with depression or anxiety or whatever in depth, other than maybe saying maybe there's some sort of a medication that might be able to help. But getting to the root cause and being able to do that in locations all around the two-county area, I think is critical that people understand that.
Yeah, I think one of the things that I know in the children's division anyway we struggle with is because the building is in St. Albans, people believe that the only services we provide are in St. Albans, and then that it could be a hardship for families who live in the the outskirts of the county.
Sure.
And so what we did actually, it's probably been a couple of years now, but we actually received an inquiry from someone in a location that was distant from actual St. Albans, and they said, you don't have services here. And so what we did is we actually looked in our demographic system, leaving the names out, but really looking at the percentage of clients that we were serving in that community. And the provider was just blown away, had no idea that we were serving that many children and families. And what we let them know is that, one of the things we find very prideful is that we are really careful with people's confidentiality. So as little as we don't wear our badges when we're in the community with kids. Those are left, in our wallets or our purses or what have you, so that we're not easily identified as an NCSS worker. So as much as some people might identify that as a negative thing, we really hold a lot of pride in that, really wanting to keep people's confidence. So I think that's something that we just continue to want to get out there, is educate how often we are serving families and how often we are actually in the communities without having a sign out front.
Yeah, right. Which I think is so important that people do understand that. And the idea is that we're here to help people. We're not trying to wave a flag and say, oh, by the way, this person's dealing with what.
That's right.
That's not the point. I think it's important that, Deana, I'm sorry, you wanted
I was just going to say we have social workers embedded in the primary care physician's offices all over. So we have Fairfax, Georgia, of course St. Albans, but all the way in Richford and Alberg and Enosburg. So just about every town.
Yeah, and the schools. I think that's actually something that that we talk a lot about too, is that in the primary care physician's office and in the schools, you tend to meet most children and families in some fashion or another. And I think schools know they're our employees, but families don't often say, "Oh, that's an NCSS
Sure.
worker.
Yeah.
That's someone who
Just somebody
works
who's
for
on the
MBU
school team.
or works
Yeah.
for someone else." Yes, that's right. And I think that's another key component to social work, really trying to figure out how to become part of that fabric of the community without highlighting that it's, you work for NCSS and you're working on mental health issues. There are a lot of issues that people come to
Sure.
us every day with that we work on that doesn't meet the DSM diagnosis,
Right.
which is nice.
So we serve over almost 4,200 individuals last year. I think it's important people understand that with everything that both of you are saying, that's actually 4,200 separate plans. It's not as if somebody walks in and you go, okay, this is going to be plan number 3 over here. They fall into that category because there's so many different dynamics at work that one of the strengths of NCSS is we are a strength-based organization. Therefore, every individual has their own plan, and it's not going to mirror anything else that you do with anyone else. I think that's important that people understand that you do that and how complicated that can be, but yet you go that route as opposed to a cookie cutter scenario.
And that's where the master's level clinician comes in. Whether it be social work or another degree, you do have to have training in creating or identifying what the resources are, what the issues are, what the concerns are, and then creating a plan from there. So I think that is a place to really identify the difference between the master's level clinician and the bachelor's, but they work in tandem. So I think that's a really important fact.
Okay. Well, let's talk more about how NCSS social workers collaborate with other community partners in serving the needs of clients.
Yeah, we've talked about where we're physically located, and I think that work is also done in those physical locations. I think from a children's perspective, we collaborate so often with schools. That is, kids go to school, and we want to meet them in a place that they feel safe and they feel supported. So we have social workers, clinicians in the schools. We have behavioral support staff that are also social workers in the schools. We do a lot of just collaborative thinking with schools around how can we best serve kids' needs. And so we do consultation and training around trauma and how to support kids in their learning. We also primary care physicians, of course, and then another place is our relationships with the Department for Children and Families. We have a team that does most of their work in the family's home, and they've been pre-identified as someone who is either at risk of becoming involved with DCF or they are already involved with DCF. And so we have 3 social workers on that team right now that work in tandem with the DCF social workers to create the best plan for those children to remain safe and supported in their community. And I think that's probably where we spend the most of our time is trying to figure out how to support families to be safe without feeling like we are aligned with DCF, and we do a lot of education and support around that. And when I say aligned, I mean more around the fact that we all have the same goal in mind, but we don't all have the same responsibilities around it. So when we're in the homes with families, we're really trying to create those safety plans and those behavior supports. And families, the feedback we've gotten is that they really trust that we're in the homes to help them intervene in the most safest ways. And I think that's one of the places where social work is primarily focused in the master's level field in the children's division right now.
Now, we've talked about other aspects where we're integrated in the community, the schools being one, primary care, but we've also got the mobile crisis team, outreach work that's done, of course, the crisis team itself,
Right.
From the various divisions. And the fact of how, and being embedded in law enforcement now, which I know is huge because many times law enforcement is called in a situation where really what could help the situation or de-escalate it is maybe a NCSS staffer also being on site to try to figure out what's really going on before further action is taken. But could you speak a little bit about the advancements that have been made in those areas over the last several years, which are huge?
Sure. Yeah, as you mentioned, the mobile outreach team, they're very involved with collaboration, even with the private sector, you know, getting out there, making themselves known to business owners and providing support to individuals that might be out there and needing a little bit of support. I'm not on that team. I'm sure Tony could speak more eloquently, who's the team leader, but I know that's a portion of what they do. They do a lot more than that. And then, as you mentioned, there is a member of the mobile outreach team who is embedded in the city police department right now and providing services to individuals that might need it there. We collaborate on my team with all sorts of organizations, SASH, which is Support and Services at Home for individuals on Medicare, CVAA. We collaborate with Franklin County Home Health often. We collaborate with all the primary care physicians and sometimes specialty physicians and offices, schools, sometimes DCF. So,
and the emergency room, that's
the emergency room, that's the other new embedded position that's happened, that's funded through NCSS. So there's an individual that works, a social worker actually, that works in the emergency department, working with folks that may need extra support that come in there.
You know, and the nice thing there with that situation is, as we know, so many people use the emergency department as primary care. I mean, when something happens, that's where they go instead of, and I know in many instances, our staff member is critical in trying to get to the bottom of why that person truly is there. And is it a physical reason, or is it a mental reason, or some combination? And I know the hospital's very proud in that they have very high utilization, but last year they were able to report a 15% decrease. And that certainly was attributed to not only the fine work they're doing there, but all the community partners such as NCSS that are also involved in trying to assist in that manner. So I know we only have a short amount of time left, but any success story that you'd like to share that perhaps a social worker was involved in at some point in time?
It's funny because Deana and I were kind of talking about this a little bit, and I think there's a lot of success stories. I think the one that comes to mind for me is less of a story and more of a framework, that when leadership, it's been years now, but when leadership had the idea of creating an intake unit for the children's division, there was a lot of ideas around how could families come in and feel supported and feel welcomed. And I think a lot of the tenets from the social work framework really went into that. A lot of the work around the strengths-based, being very client-centered, family-focused, using the genograms and the eco-maps to really understand what are the supports this family's already coming to us with, which was such a shift at that time from, what's the problem that brought you here? And so I think that philosophical shift has remained in the children's division. And I think going back to what Deana said earlier, we have a lot of social workers in leadership positions at the agency, and I think that speaks a lot to the tenets of the agency as well as the profession itself.
Yeah. Well, believe it or not, our time is up. It goes pretty fast, and I know there's a lot more that we can cover and would like to cover, but maybe another time. So I want to thank my guests, Belinda Bessette and Deana Chase, for being on the show today and sharing their insights on the numerous contributions that social workers make each day, helping individuals and families reach their full potential. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You. This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.